Just take a couple of questions in the room. We've heard some really important messages about the future being about the personalized services, about personal, about the importance of not just thinking about specialized housing, but actually recognizing increasingly general needs housing is going to be having to meet the needs of people living with long-term health conditions, frailty, etc. Question, who is the customer when you're addressing your markets? Big challenges around workforce. There's a report just out today which identifies that by 2020, even if we had somewhat different migration policies in this country to the ones we have now, there will be a 200,000 gap in the care workforce, a gap that seems to be unbridgeable other than by more support for family carers that Madeleine was talking about. So that carer and user voice being an important message. Now, the lights can come down a bit so I can see hands going up. We've got time for a couple of questions. And there's a question right at the front here, which is very helpful because I can still see that light's dazzling me still. Thank you. There's a hand over here, right at the front. And then I'll go to the back for that one in a second. We'll take two at a time. So this question here, then one at the back. They're behind you.
Yeah, me. My name's John Bartle from Nottingham Community Housing Association. What I'd like to do is share an observation with Jeremy, because I know he has the voice of the right, he has the right ears to use his voice in. And that is in respect of NHS land. We've been involved in 2 or 3 projects over the last couple of years, which fell simply because the NHS Property Agency are commissioned to make as much money as possible and ignore the other impact of the housing projects we were developing. There's a conflict there. We're not going to get out of this unless somebody breaks that conflict. Thank you.
Great. We'll go to the back and take the question that was right at the back just now. And if there's a third hand in the room, I'll take a third question, then we'll get 3 responses.
It's a question for Ray. We are a provider of services.
Who are you, sir?
Steve Barnard, HFT. We're a provider of services to people with learning disabilities and social care.
Okay.
We've been involved with the Stephen Bubb report about Winterbourne View and transforming care. We know that technology can improve outcomes and reduce dependency, but the infrastructure that ADASS could severely influence to move to outcome-led budgeting doesn't seem to be gathering enough momentum at the moment. So the infrastructure needs to change in order to actually satisfy what you're suggesting. I'd be really interested to know what you're doing to enhance outcome-led budgeting.
And just to see if there is one final contribution in the room, and there's a hand right at the front, so you'll need to run again. Thank you.
As Dr. Adrian Heald from Cheshire, just picking up Ray's point, I was really, should we say, excited to hear that you are understanding the link between the evidence base and practice, particularly around the basic sciences as well as the clinical sciences. How can we maximise the use of that evidence base in terms of what we do day to day? Because what I see is that in the NHS and in social care that I deal with, a lot of things being done simply because they're always done that way. How can we make sure that things are done in the way that the evidence base would inform us now, not in the way they've always been done?
Great, thank you very much for those 3 questions. We're going to get Jeremy to respond to the question about NHS estate, but also ask Ray if he wants to add anything to that, and then ask Ray to respond to Steve's question about outcomes-based commissioning, and then I think I'll get Ray and Madeleine to pick up on this point about how we make sure the evidence really is properly harnessed and really how you make sure it's linked to the values as well. So, Jeremy.
Yeah, really good point around how do you release NHS land. About 13% of all public land is owned by the NHS. On a very practical level, you need to be engaging with the homes and community agencies, investment management, if you haven't already done so. They also, as part of English partnerships, own and are responsible for government to release land, but there is a real danger that it often does go to the highest bidder, which is clearly the example that you've cited. But I also am aware that PropCo are working closely to develop localised strategies in terms of the asset plan and the spatial plans in relation to to all their estate. And if you don't want to look at the acute sector, talk to Liftcos and others around the primary care estate as well, not just the NHS hospital estate. And of course, foundation trusts are outside this because they're responsible for their own assets as well. But I also chair some of the work at HCA, so come up to me afterwards and I'll have a chat with you.
Anything on property and estate? Ray?
So quickly, I suppose the first note of reassurance is that I think that Simon Stevens gets it, and a number of the conversations he's had would suggest that. The work in Manchester, I think, is one source of encouragement. In my own part of the world, in North London, we're part of a devolution pilot bid that is also looking at what can we do in a whole system way to maximise the use of the estate. The NHS will want a reasonable return, but there are some times when that return might be reducing their revenue costs rather than just the capital receipt. And I can entirely understand the need for a cathartic moment about PropCo, but I hope some grounds for optimism as well.
And then just moving on, Ray, to the question about outcomes and outcomes commissioning and budgeting.
So, Steve, yeah, thank you for that, and I agree. The work will become much more individualised going forward, so I think it's not unreasonable to expect that everybody who may currently be in a long-stay institution who will need to move to community setting will have a right to an individual personal health and social care budget within a given period of time so that we can develop some much more individualised approaches there. There will be some things about where you might want more scale in terms of the investment, but again, in the localities where those changes will start to happen, I think there will be more to do. By all means, contact me afterwards because I'd be keen to connect up people who are wanting to help us transform the lives of people with learning disabilities. There will be 48 or 49 local partnerships so that it can be done at sufficient scale to make a difference in those areas. But it will be much more individualised in terms of the commissioning, which will hopefully lead to it being more outcomes focused as well.
And just to really underscore the point that Ray was making earlier about the opportunity for tech businesses to be engaged in thinking about how to manage the things that will enable complex lives to be properly supported and lived in the community. And then just moving on to Adrian's question about linking the practice to the evidence. I'm going to start with Madeleine, if you'd like to just sort of respond to what Adrian had to say.
Yeah, I mean, it's the business of being able to identify key outcomes, to track them and build the case is so powerful. I don't think we should lose sight in that, though, of what those outcomes are for individuals. And I think we need to work very hard to determine what are the individual goals of both users and carers when we're looking at outcomes-based delivery. We can look back, can't we, at something like the whole systems demonstrator and understand that we asked the wrong question, and we don't want to be asking the wrong questions, I think, when we are looking at outcomes.
And Ray, just on that as well.
So I think we need to remember that when individuals or families are taking decisions around care and support, they're often doing that at times of very considerable distress. And so to introduce the prospect of something that may feel unproven or untested, there's just a higher hurdle because that's the situation you find yourselves in. So increasingly, I think we need to present the evidence to people who are likely to want to use it in their own lives or the lives of their families in that way, or also to target the evidence at frontline practitioners whose advice they will trust. Earlier this week, I was talking to the principal social worker group who were telling me the amount of time they spend having to persuade families to get past the fact that the doctor in the hospital said, "Mum needs residential care." So the more that we can do to equip individuals with that sort of persuasive information in a way that they can access and understand, I think we will build up much more momentum for change rather than just funneling it at various public bodies. I think you need to do it at much more of a population level.
And just on that evidence point as well, Jeremy, from the housing perspective.
Really important. Again, there's some really interesting work that's coming through on a number of fronts. So again, on that issue about the culture and the leadership of some of the clinicians and looking at only residential care, places like Windsor, Ascot, Maiden, CCG are looking at how to make better use of sheltered and extra care housing to avoid admissions into residential and nursing care. So again, what's the housing offer? The Building Research Establishment with the Chartered Institute of Environmental Health have got something called the Health and Housing Safety Rating System. You can go into every local authority and look at how to better use DFGs, Disabled Facilities Grants, and the potential health gain for those interventions. And that also applies to work around learning disabilities. And just one plug for this area in Newport, the Iron Bevan Health Board has got a really fascinating project called In One Place, which is looking at those very issues around how to support people with learning disabilities move back into a housing setting with the appropriate care and support as a package rather than institutional care.
Thank you very much, Jeremy. And can we show our appreciation to our panel? I think they've demonstrated they've demonstrated very clearly to us why it's so important to see this sector reaching out and collaborating with others.